welcome and then I can.
You welcome, then Surendra sir will take.
Okay.
Okay, start.
You are not
welcoming
welcoming?
everybody now. So good evening, everybody. I'm welcoming all present in our evening session today. Today, our Surendra sir will be guiding you all first on the lecture of different subjects. I will be talking on asthma, and then Suresh, our professor, will continue on for that. Yes, handing over to Surendra sir.
Good afternoon, everybody, elect members. You are using this session for most useful purposes. Homeopathy is going to stay and prove its power of healing in days to come. No doubt in that. No doubt. 100%. Only thing is, realization by the people is very late. Because we are accustomed to, I can psychically say, during 1950s, when you were taken to the physician as a child for a fever and other thing, they'll give some decoction with measured things. We take according to the measure 3 doses. The problem is solved. Evening, night, next day morning, father and mother will send the child to the school. Because fever has subsided, everything is gone. I cannot blame. I can only say, as the fight continues between good, bad and ugly, our health, the good, fights with the virus, fights with the cancer, fights with the miasmatic, thoracic syphilis and psychosis. Sir, is there any escape? No, there is no escape. It is a property given to us through generations. Only thing is a good management and slowly removing the traces of this miasmatic condition. Yes, yes. I have been telling you other last week about prophylactic medicines and the other medicines. Today, I'll try to take only the pain management. Pain management is a very important subject for the physician. Patient come to you. Patient come to you. Innumerable pain as well as hidden problem. The physician has to foresee all these phenomena by his constant observation based on his medical as well as experience in the background, in his mind. He will patiently hear the patient agony and then try to give the best medicine. One for immediate relief of the present circumstances, namely the causating pain. that disturbs him mentally, physically, refraining from doing any normal activity. One, if the patient comes back, he can take back the entire system and try to remove, because the pain, the disturbances that is being caused may be acute or chronic. How acute? If it is for the first time, coming for 2 to 3 times and going away, it's acute. Chronic, the acute condition turns to chronic slowly by years to put it, when it is not being treated properly. This is a basic fundamental thing that homeopathic physician should understand and keep it in mind while treating the patient. All right. What are the, see, there are many diseases, many problems. 5,000 medicines will be there. 5 lakh complaints will be there. You cannot be jotting out and telling everything. By the time teacher will be swooning and the students will be running away. Understand? The thing is, pain. What is pain? Pain is one that causes disturbance at a particular time, preventing you from doing your normal activities. It may be any reason for that matter. Let us take simple things and analyze. Pain in the eyes. I am reading constantly. I got irritation, disturbance in the eye. I feel diseasiness in the eye. So by reading continuously, reading can be equated to watching TV, watching WhatsApp. All the same. Ruta is the best friend. That is why I give my daughter and the grandson, who is always the computer, doing BE, computer science, other things, and my granddaughter, who is also always in the computer, always watch. If the no work, they go to the OTT. Understand? So their life is stuck to this. Probably Ruta is the best medicine. Arnica also helps, but if there is redness and other things, inflammation, some traces of blood lines, very painful, belladonna comes. We have already told you, if pain on the left side, phygelia, pain on the right side, sanguinaria. Pain in the left eyeball, phygelia. Pain in the right eyeball, sanguinaria. Along with that, a dose of arnica. 2 doses, today and tomorrow. Yes, sufficient. For Ruta, you take it once in 2 days or 3 days, because you are constantly watching the TV, WhatsApp and other things. Where also you see, observe this homeopathic classes for 1.5 hours. Understand? Afterwards you go to some other programs, some other meetings. Understand? You can take Ruta is a very effective medicine for the protection of the eyes. Then comes pain comes from both sides of the eyeball and shoots. Shoots means it concentrates. The nerves pass on the pain to the center of the eye. Nectum more comes. Pain over left eye after cohesion is a rare thing. Patient may not observe it. Cetron is the medicine. Cetron is also called a clock remedy. Tension in the eyes, straining. You cannot read even the small print. You want to have the book near to the eyes and observe. You can see many people observing all this. Gonosmodium. Gonosmodium is medicine prepared for tulasi. Then comes pain in chest region. Pain in chest region. Arnica is the safest and the best remedy. Sore feeling, bruised feeling in the chest. Sir, what is it? Sore condition and bruised condition. Bruised means exhausted. So, you feel like relaxing yourself. Even then, you don't feel comfortable. Even then, you won't feel comfortable. That is called bruised feeling. If mental condition is like that, you will say famished. Ranunculus bulbosus is good for pain in the chest that comes as a relief to the intercostal muscles due to rheumatism or any other condition. And you feel pain in the chest region. Then comes space between the two lungs. Here you can see between trachea and then left lung and right lung. The space between them. Because it's a constant pain, changes from person to person. There, pain in the anterior mediastinum, that is mediastinum, both sides, anterior, inside. Medicine is gluteria. Pain shoots into the shoulder from chest. It goes to the shoulder, then rest stops. Cold stitches, sensation of tightness in the chest, hoarseness, sore throat, that hurts the patient even while talking. Cough ends in sneezing. When cough is there, you sneeze. Peculiar. Cough and sneeze. The medicine is Seniga. Seniga, the best medicine. Rheumatoid is a sharp sticking pain through the left leg. Early stages of phthisis. Phthisis means beginning of tuberculosis. Beginning of tuberculosis. So Rumex is the best medicine to prevent onset of phthisis also. Of course, we got bacillum, other medicines also, natrum, some other medicines are there. That management is a very difficult process. Then comes calicorn, twitching pains in the chest, especially right side, works between 2 to 3A. 2 to 3A. Then comes actia racemosa, works in the right side, especially in the nervous woman. Those women, when somebody shouts also gets nervous. When mother shouts also, the child gets nervous. Then Acalypha indica, constant severe pain in the chest with bloody expectoration. When pain is there, you cough or you sneeze, you get the blood expectoration. Here, Acalypha indica is a header. What more other medicine was suggested long back? Bleeding from any orifice, hemamelis. Hemamelis. Okay. This is refers to pain management. It refers to the eyes and chest. Then comes limbs, teeth. Teeth is a small one, I will complete it. You all know, we have been repeatedly telling you. Pain in the teeth, aurum triplinum, pulsatilla, Cappia cruda, phosphorus, Hecla lava, creosotum. Then comes plantago. Then comes hyoscyamus. These are all the common. When pain comes, we have suggested you to take the plantago mother tincture, put a cotton bud there, apply on the teeth. You can take either hypericum, you can take Hecla lava is the best medicine, which is prepared from mountain lava. Aurum triplinum, very best medicine. Cappia cruda, also best medicine. Immediately, the pain gets relieved. I am not joking. I am not joking. I have also repeatedly told you. When I suggested this, they asked to call back and say, sir, I have exhausted the medicine that you have given. I have thrown the bottle. You please tell the names. They asked. Because you see, nowadays there is a difficult thing to contact everybody from moving from place to place. So use the media, phone. You tell them to go to the nearby homeo shop. Ask them. If any doubt, you please give the call to me, I will clarify them. So everything is revealed, everything is settled. When the patient receives them, he feels very happy, very happy. This takes a number of times. I am not joking, I am not exaggerating. Just pain relief is the best medicine. I told you several times. Dr. Rangachari, whose statue is there in the General Hospital. It was built by the British people. He was the first Indian surgeon and physician. He used to make many recoveries through this pain management, very cleverly adopted by him. He is the one who has discovered that when husband is, wife is, or husband is sitting in the chair, wheelchair with pain, try to remove the davani, that is covered part of a woman of his, and husband immediately rushes, gets up. All these things, every day they have been giving physiotherapy. It is not responding. Immediately for this, psychologically responding. Next thing is, a woman constantly complaining about headache. He has given all the medicine. Immediately one day it struck him. Asked the woman to remove her diamond nose bit. Nose bit. Within a day, the headache did not happen. With medicine or without medicine. This is pain management. Of course, we'll go to different parts. I'm only taking not all the diseases in the eye or chest region. I only taken the management of pain. Like that, I'll try to take you muscles and joint, the rectum, and two other things in the next class. Thank you very much. I'm passing over to Anu.
Yeah. Thank you, sir. Thank you, sir. So the medicine, what you said, the doctors used to give when everybody goes in the olden days, no? A pink colored liquid. Yeah, that is called carminative liquid, carminative mixture. Yeah. Now that works very well those days, but now nobody goes for that. Today we can discuss asthma, which is again many people do not know why asthma is happening and what is really asthma. How do people suffer with asthma? All those things we can discuss and then we will see how. So what is asthma? Asthma is a condition in which our airways, that is our trachea and bronchioles and the bronchial region and the chest region, everywhere it gets that's the air passage, and the air passages get narrow and swell, and they produce extra mucus. So they may do it all three together or separately also. That is swelling, narrowing, and then mucus. So now this combination of all these things together or separately, this can create breathing difficulty and which will trigger cough, because when mucus is filled in the tubes, there will be cough eliminated. Yeah, somebody's mic is on. I think if it scares me, your mic please off. Then trigger in coughing. The trigger of if you trigger coughing, cause a whistling sound, that is called wheezing. When you breathe in, breathe out, and can have shortness of breath. So this is what asthma symptoms will look like. They'll have the airways blocked, their breathing will be difficult, and they will have cough, mucus-loaded cough-like feeling. Then there will be whistling sound when they breathe out and have short breath. So what happens to respiratory system when during asthma attack? So during an asthma attack, what really happens inside our system is not known to most of us. So we'll listen to that. During asthma attack, the muscle wall contracts. The muscle wall contracts, and the lining of the airways become swollen and inflamed, causing narrowing of the airways. So the air passages, that is trachea and bronchial and bronchia regions, the muscle of the walls get that shrinks up, contracts, and the lining in the airways becomes swollen. So the inside lining will become swollen, the muscle will shrink, and this will cause narrowing of the airways. And further to this, the aggravation happens when increased mucus is produced. Mucus is produced in large quantities inside the lining. So this way, the total area will be blocked. This in turn actually blocks the smaller airways. So if the mucus is not there, the airways is small, still air will pass. But when the mucus is formed and it clogs the way, then breathing will become very difficult. So during an asthma attack, three things can happen. One is bronchospasm. That is bronchial waves. Airways becomes spasmodic. The muscles around the airways constrict. When they tighten, it makes the airways narrow. Air cannot freely flow through it. That is bronchospasm. Next is inflammation. The lining of the airways becomes swollen. Swollen airways does not let the air pass through it freely to the lungs. So that is inflammation happens there. Third thing is mucus production. The mucus lining produces excess mucus. This mucus clogs the airway. So three of these things together makes the asthmatic patient will suffer not to take a little breath. So we will see the picture of the normal and the asthmatic lungs, the airways. So he can see the muscles are relaxed, and the tube you can see in the proper shape. And from inside also there is a proper passage way, and also the muscles are of normal shape. So normal mucus also is found inside that. But when it is an asthmatic case, the muscle wall is swollen up so much, and the passageway is reduced to so small a way. And if mucus fills in this, that means it is blocked. You can see the trachea and the airways and all are crushed because of the tightened because of the asthmatic condition. So why is it harder to exhale during an asthma attack? So exhale, even though inhale or exhale is difficult, so exhalation is also not possible, because during asthma attack the air gets trapped inside the lungs. So lungs, the way outside is constricted, and the person cannot push the air out because the passage is blocked, and it will be difficult for even to exhale. The excess mucus secreted will block the ways and prevent the airflow through them. So even if he try to force to breathe out, the mucus will be blocking the ways, and it will be difficult for the patient to breathe out. So you can see again the better picture. Normal airways will have a larger passageway. The constricted one, asthmatic passages airways will be with a distorted passage, and during a real attack, when mucus also will fill in this, and you can see the bands outside, the muscular bands are smooth here. They are still better, but when it is asthmatic, they tighten up and constrict the outer walls of the airways. So the diagrammatic the cell picture, which is explaining the same thing. Air passages get blocked. So when the air passages are tightened by muscular things, you can see the alveoli are full of air, but it cannot escape through the trachea or the bronchioles, because it is tightened up by the muscles, and the passage also is small. You can see it is tightened up, and the air passage is blocked. So the air inside the alveoli is locked inside, and that is why when they try to exhale, it is not going out. So what are the usual asthma symptoms? Asthma symptoms are obviously obvious, that is, we can visibly see, and these resemble to many respiratory diseases, respiratory infections. Chest will be tight, that tightness of the chest, pain or pressure will be felt. Coughing, especially at night during exercise or when laughing. So if you do slight exercise, you will feel coughing, like coughing, and even if you laugh, you will end up in coughing, and night invariably you will be coughing. So that is one of the asthmatic symptoms. Then wheezing, when you breathe out and this thing, there will be a whistling sound, wheezing sound, and they will have difficulty in breathing and also shortness of breath. These are the common symptoms of the asthmatic patients. Then one is adult onset. What are the types of asthma? So the one is the adult onset asthma. That means when they're child, they are not having problem. When they are adult, they are having asthma symptoms shown by some adults who otherwise were not asthmatic till such time. This is known as adult onset asthma. Sudden exposure to stimulants that triggered asthma, like pet dander, the skin and hair flakes of dogs. When you have pets at home and their hair and skin bits shed in the rooms, and while the fan is switched on, it flies up and you inhale it, and that will cause irritation to your airways, and that can be a stimulant for this sudden exposure to such stimulants. Then chemical fumes. Sometimes when you are exposed to chemical fumes, that also will irritate the airway passages, and it will also shrink and cause these sort of problems. Certain dust particles can also become some irritants. So all these unwanted things which is you are exposing to can cause these sort of problems. Sometimes some types of virus too can cause asthma-like symptoms with the upper respiratory tract infections, and with a cough that lasts very long. So viral infections in the air passages also can cause asthma-like symptoms. But normally it is the irritant or reactions, the allergic reactions, or some stimulants which are causing these sort of things, if not autoimmune, let us see. Then is allergic asthma. The allergic asthma are linked together often. That is, allergies and asthma are linked together often, but not. But it is not a must that all asthmatics will have allergies, or all allergies will end up in asthma. So that is they are connected, but not dependent on interdependent to show the expressions. Allergens such as pollen, dust, and pet dander can trigger asthma symptoms and asthma attacks. So allergens, like sometimes when you have early morning sneezing and asthma type of feeling, it's because of pollen dust which is flying in the air, pollen from flowers. Then even the other irritants like the pet dander, pet dust, pet's hair and skin dust, and the dust also can create asthma, and these are called allergic asthma. This is called allergic asthma. The common allergy test can be useful for controlling allergic asthma. There is a common allergic test. There we'll see how it is. What do they do to test an allergic skin testing? So the skin is prick test. A skin prick test, also called a puncture or a scratch test, checks the immediate allergic reaction to such as many as 50 different substances at once, which are introduced under the skin on the forearm. So they will put your forearm, and on the forearm they will give you 50 different types of substance which can be potentially causing allergies to others, to all of, and then your allergy reaction may be only to one or two specific things. So they will mark everything, and then they will give you a small dose of all those allergens inside your forearm, and wait to watch to see what is this. Usually irritants like pollen, mold, pet dander, then dust mites, and some foods are used for the test. So different food allergies also are there, so they will use all those things. Some 50 articles, 50 items are tested on a person at one stretch. The irritant that triggers reaction are identified and will be advised to avoid those carefully. So this is a simple method. So they will give you a test dose of 50 items, and if you are reacting to a few, they will tell you don't use that or don't go near that. So the next is asthma COPD overlap syndrome, ACOS, asthma COPD overlap syndrome. This is when both asthma and COPD, uh, uh, the COPD is chronic obstructive pulmonary disease, that is COPD, and chronic obstructive pulmonary disease. So, is a collection of lung disease that causes breathing problems and obstruct the airflow. So that is COPD, which include severe asthma, emphysema, and chronic bronchitis. So that is it's a combination of both. So ACOS include all type of asthma along with excess phlegm, feeling tired, low physical tolerance, and tolerance for exercise, shortness of breath, and during routine activities. All symptoms may not allowed to be severe, always be severe. All symptoms may not always be severe. The ACOS is serious and can be deadly if you don't treat it properly or don't care for it. Sometimes it can be too aggressive. You may not have the chance to survive. So it has to be attended to properly. Hence, proper care is needed immediately on detection. Treatment of both asthma and COPD has to be taken to full recovery. Yeah. So exercise-induced bronchoconstrictions, and symptoms develop when the airways narrow as a result of physical activity due to loss of heat, water, or both from the airways during exercise. That is what you see nowadays when the good gym people doing a lot of exercise and suddenly they collapse and die. So maybe this is the reason also, the exercise-induced bronchoconstrictions. And during exercise, when quickly breathing in dry air, the constriction happens. In addition to airborne irritants like chemical vapors, perfumes, the perfumes, the paint cleaners and paint materials and polluted air can also be a trigger for exercise-induced constriction. Then common symptoms of exercise-induced constriction include shortness of breath and wheezing, decreased endurance, tightness of the chest, cough, upset stomach, and sore throat. These are the common symptoms of exercise-induced bronchoconstriction. Non-allergic asthma, that is illness, medication, environmental factors. Illnesses, medication, and environmental factors are the common triggers for non-allergic asthma. The symptoms flare up in extreme weather, either in the heat of the summer or chill of the winter. And stress and strenuous exercise also triggers this asthma. So these are the non-allergic asthma symptoms and causes. So occupational asthma, the name implies the occupational asthma means breathing problems due to the conditions in the working environment. So the place where you work has some conditions which will be pushing you to respiratory problems. This can include certain fumes of chemical vapors. If you have wheezing, coughing, chest tightness, shortness of breath at work, you may have occupational asthma. People working in cotton factories, in knit and woven factories, where they have cotton dust flying around, also can have this sort of problem. It's called occupational asthma. Occupational asthmas are seen usually in bakers, detergent manufacturers, drug manufacturers, farmers, grain elevators, research and diagnostic labs where they have a lot of solvents, vapors evaporating, metal workers, miners, plastic workers, wood workers where they have wood dust. And I told you about this factories, knit and woven factories, garment factories, where the cotton dust flies. So now we will see homeopathic treatment for asthmatic patients. Most of the patients will be presented with severe difficulties in wheezing Aconite can bring temporary relief to many if the cause is due to shock or sudden exposure to cold or due to stress or vexation. With proper case taking and depending on the constitution of the patient, various remedies are available. A few of the most effective remedies are given here. That is arsenic album, allium cepa, ammonium carb, ambrosia, antimonium tartum, bryonia, carbo wedge, epasalt, thalybichromicum, thalyphosphoricum, and lobila inflata, lycopodium, magnesium phosphorica, naxomica, pulsatilla, sabadilla, sanguinaria, spongia. There are many more, and these are the common ones which is used. And in general, for the most asthmatic patients, the following treatment schedule can be tried and which will give good relief. That is sulfur 32 drops in the morning, 6 days daily, and 1 day we can give it as a gap. So the continuity will break and then start again after the 7th day if required. Then calcarea carb 2 drops in the morning, 6 days daily. 1 day we can give a gap depending on the constitution of the person, if they are calcarea carb patient. Ipecac 30, 2 drops 3 times a day. This constriction of the chest and cough, incessant cough, and violent cough with every breath. Chest seems full of phlegm. So this is the condition, and you can give Ipecac 2 drops 3 times a day. Aradia racemosa 2 drops 3 times a day when the cough is aggravated when you lie down. Then biocombination 2 4 times a day, 4 tablets 3 times a day. So these are the normal easy method which you can try out. If it is not working with this, then we have to go for the additional case checking. So following mother tinctures also can be used for long-term treatment. Should be had for at least 6 months to get permanent cure. That is Blata orientalis. That is mother tincture, 20 drops 3 times a day in a half cup of water. Pothos, when there is dust allergy and that is the cause of all these things, pothos works well. 20 drops 3 times a day in a quarter cup of water. Rendelia, 20 drops 3 times a day in a quarter cup of water. And there is a preparation medicine for Dr. Requick, R43, asthma drops. 10 drops 2 times a day in quarter cup of water, daily for 6 months. Can bring all needed relief. If any of these are taken, you will get some good relief. So that's all now, and I'm stopping here. Okay, sir.
Yes,
Thank
sir.
you. Yeah.
Is my voice audible?
Yes, sir. Yes.
Namaste, my dear homeopaths. Last weeks I have taken amenorrhea and anemia, that is chlorosis, like this. Today I am taking dysmenorrhea. It is nothing but difficult or painful menstruation. Generally, 90% of the ladies, irrespective of their age, they will complain the stomach pain during the menstruation, either before or during or after also. So it is nothing but a painful menstruation at that time. Some people manageably they are managing that one, but some people they cannot manage, they will go for medication, strong painkillers they will take. Causes for dysmenorrhea, that is causes for menstrual pain. Endometriosis, that is inflammation of endometrium and inflammation of uterus. And mental disturbances, most probably nowadays all the ladies, 99% of the ladies are suffering with this only, mental disturbances. At the time of, because they know which date it will come, before that they must keep quiet, calm. They should not react on any matters. If such is the case, naturally dysmenorrhea will be reduced. Due to suppression of menses, because of their routine work or some get-togethers or whatever it may be, they will take certain medicines to postpone it and everything. Because of that one, this type of dysmenorrhea will happen. Dysmenorrhea due to rheumatism and gout. That is generally it will be after 40 years people, you will be there. Even for this rheumatism in joints it may come, rheumatism intercostal region will be there. Generally obese ladies, intercostal area means left lung or right lung downside. Just now our Surendra sir has told ranunculus bulb, and along with bryonia it will set right. Ranunculus bulb, our Surendra sir has told that medicine now while talking about it, and that also this above 40 years ladies who are having dysmenorrhea along with some chest pain, preferably in the ribs, left side or right side, at that time we have to give ranunculus bulb and bryonia, 1 or 2 doses will reduce. And gouty people, generally it will come, whatever the medicine if you give for dysmenorrhea it will not work. For gout you have to treat properly. Gout we will take separate class afterwards. Gouty is the most important. Several people are suffering with that. Sometimes they will shout like anything. Even after taking Dolo 650 also, they will shout because of the pain. Next, types of dysmenorrhea. Primary dysmenorrhea, it is nothing but in the starting stage, after puberty, the people cannot accustom with any spasm in the stomach. So this will be common by everybody. Generally in the house itself, the parents will take some precautions. By that way, it will be reduced. And second is secondary dysmenorrhea. This is one of the type where pain during the menstruation experiences some stage, the establishment of normal flow. The normal flow will be obstructed and pain will be there. Because of the pain, normal flow is obstructed. For that, we are having good medicines that also we can give. And membranous dysmenorrhea, it is one of the typical dysmenorrhea that we have to see. The gynecologist will tell this one. Through their mouth only, through their symptoms only, we can know this one. It is due to exfoliation of membranes of the uterus. That is peeling of dead tissues of the uterus layers. This exfoliation may deep superficial, giving rise to pain, abnormal pain. And this also, suppose we can ask in a polite manner, we have to ask, how is the flow? It is just like watery type, or clotting type, or flakes type. Like that, if you ask, if it is a clotting type, means it is nothing but membranous dysmenorrhea. If it is general flow, heavy flow, or stop and come flow, that it is not a membranous dysmenorrhea. Only membranous dysmenorrhea, you will have flakes type or clots type. At that time, we can see that this is membranous dysmenorrhea. Separately, we have to give certain medicines for this. Next is congestive dysmenorrhea. It is nothing but inflammatory dysmenorrhea. Inflammation of the pelvic organs. Because so many people nowadays running fast, driving a scooter like that, so many things they are doing, ladies. And ladies are sometimes they will wear very tight what we call pants. All these things will create a congestive dysmenorrhea. So at that time, at least those days, they must have loose clothes under the pelvic organs. That we, if possible, we can tell to the family members. We cannot tell directly to the concerned lady. So for this, all these type of dysmenorrheas, we are having good medicines in our this one. Starting is, if he is having a fear, sudden chill or sudden fright, because of that one dysmenorrhea happens, means aconite and belladonna will sufficient for them. Aconite and belladonna. And I think Surendra sir has told one thing, pain we have to reduce. Some doctor name he has told, Rangachari. Dr. Rangachari about he told. That doctor generally, first he will give pain reliever. So first, once pain is relieved from the body, the patient will like our homeopathy medicines. So for that, in the Clark, who has written 3 volumes on homeopathy, Clark himself has prepared a combination of aconite, belladonna and chamomilla. This everybody he will give first dose. 1 dose of aconite, belladonna, chamomilla prepared in a combination drug, he will give for everybody. Aconite, belladonna and chamomilla. Not only the pain it will relieve the inflammation, and it will relieve any anxiety or the fear. So naturally the patient will accommodate to our drugs. So that is the procedure of Dr. Clark, who has written 3 volumes on Materia Medica. Of course, it is a good combination. Several years, several people have used that combination successfully. There will not be any failure in that. So aconite, when you are having a sudden chill or a sudden fright or a great restlessness and anxiety, at that time we have to give 1 aconite. Otherwise, you give a small vial of pills. Aconite you put, AC you put, and give it. Whenever you are feeling like these type of symptoms, you take 1 or 2 doses on that day. It will not relapse. Like that also you can give to our patients. Next, main medicine is Cimicifuga. Cimicifuga. Cimicifuga, very useful. It is a rheumatic dysmenorrhea, neuralgic dysmenorrhea, spasmodic dysmenorrhea, with pain in legs also. It's traveling. The pain travels from pelvic organs to lower extremities. At that time Cimicifuga will work, but generally single medicine I will not give. Along with Cimicifuga, if we give magnesia fast, very quickly the second day or third day itself the pain will be reduced. And because Cimicifuga will reduce severe pains in the abdomen and ovaries and cervix, everything it will cover. One more thing, certain people will tell, we are having pain, not only pain in the lower abdomen at the time of menstruation, we are having pain in the thighs also. And if they are telling thighs also, you have to put Pitolacca, Cimicifuga and Pitolacca, it will work excellently. Next, Caulophyllum. Caulophyllum is one of the best remedies. Caulophyllum. Caulophyllum. It is good for neuralgic and spasmodic dysmenorrhea. Pains in the first 1 or 2 days before starting the flow, first day or second day, Caulophyllum is one of the best remedy. Previously I told, when we are talking about rheumatism, I have told small joint pains. When small joint pains are there, we are having Actia spicata, Caulophyllum and Ruta. These three medicines are very, very important for small joint pains, preferably finger joints, wrist and everything. Like that, this Caulophyllum will work for ladies at the time of pregnancy, at the time of delivery. When false pains comes, then Caulophyllum will be working very excellently. Next, conium. Menstrual pain because of inflammation of uterine region extending to thighs. And preferably conium we will not give immediately. When anything is there, mental problems are there, mind oriented problems, then we can give this one. And preferably certain ladies having menstrual period, they will have vertigo, they will have giddiness. At that time we will give conium along with gelsemium. Next, another thing is Viburnum opulus. Viburnum, Viburnum opulus, Opulus. Very useful for spasmodic and membranous dysmenorrhea. Too late, too short menses will be there in Viburnum opulus. This is also one of the best remedy for pain reliever. As a third medicine we can give this one. Menses is offensive, whereas in Viburnum opulus, menses will be offensive. They have to go twice or thrice. Washing will be there. The patients, they will themselves will tell that one. At that time we have to ask whether the pain smell is during menses period or generally any smell is there. We have to bifurcate. It is a menses flow smell or whether they are having white discharge. When white discharge is also there, smell will be there. Accordingly we have to treat for white discharge also. So next chapter we are taking white discharge, that is called leukorrhea. Next, another thing, xanthoxylum, Xanthoxylum. Xanthoxylum, it is also one of the good medicine for neuralgic dysmenorrhea. Very painful menses due to ovarian disease. Previously they will have some fibroids case or PCOD cases. They will have this type of pain. The pains are agonizing. Here burning will be there. Xanthoxylum, burning pains will be there. Next, colosynthesis, one of the best remedy for any stomach pain, not only menses period, any gents or male or female, boys or girls, whatever it may be. The pain or the symptom is, the pain will be relieved by bending double, by bending forward, pain will be relieved. At that time, colosynth we have to give. Next one is belladonna, you know pretty well. It is for inflammation, congestive, dysmenorrhea. It is a good remedy. But anywhere you will have a burning sensation or irritability sensation, everything is there, belladonna. And their moods also swings at that time. At that time, belladonna we have to give as a secondary drug. And epismel, certain people will give. Generally, as far as my knowledge goes, epismel will be after 35 years or 38 years of the age. We have to go, not for the young girls, as far as dysmenorrhea is concerned. So dysmenorrhea, we are having good remedies. Even epismel, if the symptoms tallies, means we can give. Stinging pain will be there. Stitching pain and stinging pain will be there. Next, Murex is one of the best remedy. Dysmenorrhea due to chronic endometrium. The endometriosis, the inflammation of lining membrane of the uterus. This will be seen by pathology report. And as far as medicines are there, ferrum phos, magnesia phos, kali phos, compulsorily we have to give 15 to 20 days after menses. Minimum 3 weeks we give, that will be set right. And the next menses period, the pain will be very, very nominal. And in the second stage, if you give second round of treatment, here after that they will not get that one. With this, our dysmenorrhea is over. Suresh Kumar sir. Suresh, you can take.
Oh, it's coming.
Thank you, thank you. No
Shall I
sound.
commence?
No asa. Yes.
Yeah, continue, sir.
Yes, yes. You continue.
Is it audible to everyone?
Yes, sir.
Yes, sir.
Everything is okay. So, very warm good evening to all the team members, and we were going through the selection of pregnancy in the last classes, and in which various parameters or various criteria as per our organon. I have started telling about this, in which I first gave you about the various list of what are the observations to be made. And first I said about the susceptibility of patient is very important in selection of potency. And then factor relating to patients, I also said about the age factor is very important. How to prescribe in case of infants, children, how to prescribe, what should be potency usage in case of a young person, and what should be the potency type in case of adult, and what should be for the senior citizens and geriatrics. And then in case of the patient with reference to sex, gender, how it should be for the females, how it should be chosen for the males because of their susceptibility, because in village the type of person's susceptibility is different, whereas in urban centers, in metros, etc., the susceptibility is different. So how to prescribe sex wise or gender wise, how to. Then I have also given in last class the influence of the habit and environment, and based on that how we should choose our selection of potency. So with that we'll continue. Now the next important parameter is which is constitution and temperament. That is more important. Selection of potency is very much based on the constitution and temperaments. So higher potencies are best adapted to sensitive persons of sanguine or choleric temperament people, intellectual persons who are very quick to act and react, persons who are jealous and impulsive in character, impulsive in emotions. So such type of persons are requiring a higher potency. With reference to temperament, there are, I just will give additional inputs. Like with reference to temperaments, there are 4 temperaments are there. One is sanguine temperament, the other is choleric temperaments or bilious temperament. The third one is phlegmatic temperament, and the fourth one is nervous temperament or the melancholic, otherwise it is known as melancholic temperament. These are 4 different temperaments as from the point of view of constitution. So sanguine temperament is related to blood or the rush of bloods, on account of which various manifestations which are occurring in the body. So it is relating to, basically, if we talk about the rush of blood, it is relating to heat and fire, how the heat and fire influence the ecology of the body system. So that is related to sanguine temperament. And particularly with reference to sanguine temperament, patients are very optimistic in character, they are cheerful in nature, they are very confident, they are very courageous, and they are rational. These are the qualities of the patients which fall under the category of the sanguine temperament. So they are optimistic, they are cheerful, they are very confident, they are courageous, and they are rational. So these are the qualities of the patients belonging to the category of sanguine temperament. Now coming to next temperament is chloric temperament or bilious temperaments, which is related to liver or the bile secretion. So on account of the bile secretion abnormality or the disharmony or irregularity, anything which is causing external manifestation, and their mood and their reflections in the patient, that will fall under this temperament. So these type of people, the chloric people or the bilious people, they are of very ambitious people, they are very dynamic people, and they are seen as leaders in the society, and they are easily angered, they are angered easily, and very restless in character. So these are the prominent characters at the mental level of this bilious temperament. I repeat again, they are dynamic in nature, they are ambitious in character, they are leaders in the society, and easily they can be provoked, they can be angered, and they are very restless, highly restless in nature. So these are the qualities of the bilious temperament people. Then coming to another temperament is called phlegmatic temperament. Phlegmatic temperament related to the lungs, the secretion of phlegms from the mucous membrane, or otherwise from the point of view of how the person is influenced by the moisture, how the person is influenced by the water content in the environment and its effect to the patient, the moisture and the cold, the wind, that is wet wind, these all are influencing to the phlegmatic type of person. So their character reflections, how they will be in their mental plane, so that if they will look into the phlegmatic person, their mental, they will be very calm person. Phlegmatic persons will be very calm, very thoughtful in nature, very peaceful in approach. They will work very slowly, but very attentively and cautiously they will work, and they will be very friendly and very easygoing in nature. So these are some of the prominent characters with reference to phlegmatic type of temperament of people. So these people these are calm people, thoughtful people, peaceful people, work slowly but very attentively, friendly and easygoing in nature. So these are the different characters of the phlegmatic type of temperament people. Then another variety is temperament. Fourth type is known as nervous type of temperament or melancholic. These are the two names have been prescribed here, two terms, nervous and melancholic. And these patients, the reflection is on account of the brain, or rather we will put into central nervous system changes or affections to the central nervous system. So mostly these people are largely affected by the wind, blow of wind or blow of air. So because of the changes in the central nervous system on account of the breeze, on account of the air, on account of the wind, storm, etc., these all will have this changes in this type of people. So these type of people characters, if we look into the nature of these people, the nervous people will be very serious, they will be very cautious in approach, they are suspicious in character, they are pessimistic, quiet, unsociable, they are reserved. On the other hand, these people are very talented, highly creative, and they are daydreamers. I repeat the characters of these type of people. nervous type temperament or melancholic type of people. They are very serious in nature, they are cautious in character, they are suspicious, they are pessimistic. These people are quiet and unsociable and reserved. On the other hand, these people are very, very talented and highly creative in their character, highly creative character, and they are daydreamers also. So these are the four type of temperaments uh, which which I have explained from the point of view of mental plane, how they will be having the characters from the point of view of the emotion or the mental plane. So, from the for the selection of potency, it is said that for whenever there is a sanguine temperament, people have been seen, or whenever the choleric bilious temperament people are there, we can prescribe higher potency, and particularly those who are very intelligent and intellectual in character, definitely we can prescribe them higher potency. But whereas in case of phlegmatic individuals who are dull in nature, dull in comprehension, slow in action, particularly two categories, phlegmatic and nervous melancholic group, this group. So for this group, the lower potencies with frequent dosage, this is been advised. That is particularly sluggish individuals, then gross habits, those who possess very high muscular power and who require powerful stimulus to excite them. Such type of characters of people, they require lower potencies in frequent dosage. In brief, I can say the sanguine temperament and choleric temperament, they require higher potency, whereas the phlegmatic temperament and the nervous temperament and melancholic group, they require lower scale of potencies. Then next, another important selection of potency, sensitivity. Oversensitive patient. The sensitive patients will prove every remedy given in higher potency and will fail to have their sickness cured. Such patient must be given of the indicated degree in a low potency, particularly from 3rd to 30 potency, or in drop dosage of the tincture, mother tinctures, as a single dose at a time, or longer interval with longer intervals elapsing between the two doses in order to bring about curative action. So in oversensitive patients, it is low potencies are being recommended or advised, particularly from 3 to 30 potency. It can be a single dose or it can be a split dose also at a longer interval. Then another sense, when we talk about the sensitivity, the other group is we are known as idiosyncratic patient. There will be idiosyncratic type of patients also will be visible in our clinical cases. So they possess very higher susceptibility, but must not be given higher potency. It is sufficient to give them the 30th potency only. The dose may be repeated twice or thrice, or even at a longer interval if needed. Otherwise, these patients generally require lower potency only. So in case of idiosyncratic persons, generally it is advised, because of their higher susceptibility, and should not be given higher potency. So better to give them a few globules of 30 potency itself. It can be even repeated at a longer interval of time also. So these are about the selection of potency with reference to constitution, the temperament, and their sensitivity. So I have talked about those three aspects today: how to prescribe, how to select the potency with reference to temperament, with reference to sensitivity, and with reference to idiosyncratic persons. So with this, I will give a pause and we'll further travel into more of this in our next class. Over to Dr. Murthy.
Thank you, sir. Thank you, sir. Muthu, sir.
Yes, sir. Yes, sir. Any questions? Any questions?
Sir, is there any relation between asthma and eczema?
Yes.
Both are skin related thing. There is some hidden relationship, because if you don't treat asthma properly, there will be eczema type of skin irritations, and if the eczema is not treated properly, there will be asthmatic reactions later on. So it's a known fact, but visibly the reason is both are like affecting the skin area. The skin inside the lungs is getting affected and inflamed. Inside the tracheas and bronchioles are getting affected. So basically it is a skin reaction, and it has a relationship.
Okay.
No, Sir George sir, in his
Sir.
notes, when Anup Kumar while he's telling, in his notes he has mentioned two first and second point about drugs. First is sulfur 30. For 6 days, 1 dose daily you have to take. 1 day you have to give gap. Or he has put R. Or calcariacar 30, 6 days continuously, 6 doses, 1 day gap. Why he has given that one? You think about it. If a patient is having skin diseases along with asthma, this way, that way it is coming, means you have to go as per sulfur.
Yeah.
One thing. Suppose if a person who is walking and doing some extra work or everything, when the person is very tired and having palpitation or anything and fat and flabby, then you have to select calcariacar. So here the selection of constitutional remedy is the most important. For that only he has given the first medicine as sulfur. He put R, OR. Next calcariacar he has given.
One more I'll add, sir. One more I'll add. This asthma has various causes. The prominent one is the inflammation. Inflammation can be because of skin. Then the other thing is allergic reaction. That is again coming from external causes. The first one, the treated and not successful, and then coming as eczema, is related to the skin. The other one is external characters because of allergic reaction. So that will not be related to eczema. So the causes are also to be studied. If it is allergic asthma, it will be allergy only. If it is they have the genetic side of it, they have inherited the asthmatic symptoms, that will have this essentially the skin problem. So for them, sulfur has to be given to break the continuity and also to treat the issues. So as I told you, there are various causes of asthma. No? One is occupational asthma. If we treat occupational asthma, and if you fail, it will not end up in eczema.
Okay.
So the allergic asthma will not, but the other asthma, the genetically or the skin-related asthmas, that can end up in eczema because both are skin.
For
Shall I-
skin oriented asthma, we are having another two medicines. One is Ambrogracia. The second one is ammonium muriaticum. These two medicines also, please read. This is somewhat will have, even actually he has told ambrosia also, but Ambrogracia and ammonium muriaticum, respiratory problems, anything along with skin problems, these two drugs are also very useful.
Suresh sir, you were saying something.
Yeah. George sir, whatever is being told by Dr. Murthy and Anup, I just want to add one more information to, because the question you have said that whether the asthma and the eczema, I am not going with the nomenclature of the term, because let me put into one that is a respiratory trouble, another let us put it in skin trouble, whether how they are. So if you look into the constitution aspect of it, both of them are falling under psoric category. Because of the psora miasm, these flare-ups are occurring at the respective sites, respective organs. So, what happens in case of psoriatic flare-ups? So these type of persons during the windy condition, winter state, or in case of a high moisture content, or in case of high water content, or coldness in the environment. So this provoke them, and what happens? The asthma or the respiratory problem, bronchitis, etc., they are exhibited out, suppressing the skin trouble. What happens when this one disease is prominent and other disease will be they will be passive. So what happens in case of when the asthma or the respiratory type of symptoms are at a higher degree, they at the time skin troubles will be at a lower ebb and they will be not shooting any trouble. But the moment the environment changes or the climate changes or the asthma is being treated or asthma is in the lower ebb or lower degree, then what happens? The passive or the dormant skin trouble which is there, they raise their head, they show their exhibit as so what happens? This is happening in our Maitreya Medica also. Symptoms are given, that is the respiratory symptom as well as the skin symptom alternate each other. So whenever the winter is approaching or the such type of climate is there, the respiratory troubles are at a higher degree, and when there is autumn or when there is a progress towards the summer season is there, automatically the respiratory problem will be at the lower degree, and the skin troubles which is suppressed, they come to the surface level and they become dominant and they exhibit themselves. So this is known as alternating symptom as per our organon and as per us Maitreya Medica. That's what I want to substantiate to this.
Thank you.
I want to substitute something.
Yeah.
The thing is, not all cases of asthma will result in eczema.
True.
Not all cases,
Yes.
except a few. Suresh has given an explanation as to how the disease metamorphoses into skin disease
Yeah.
or something like that. See, the homeopathic medicine that trying to cure the asthma, the morbidity want to be expelled. The process is very long drawn process. In the melee, it may spill over to other organs, not necessarily be skin disease, but mostly it is linked to skin disease because the blood, the medicine that gives the lungs expels them and brings them the blood. So that naturally skin eruption may take place. It is called eczema. If this happens, I assure you, the asthmatic patient will be 100% cured. 100% cured. Because he has started exhibiting recovery of the lungs and asthma. Then
Okay.
we give graphitis. We give graphitis to expel the eczema. In most of the cases, the eczema will appear in the lower limbs. That is a hiding factor. You can put a cloth there and walk freely. But it will take 3 to 6 months. When asthma is cured and eczema is more exhibited, you give higher dose of graphitis. So cure will be very, very, very fast and imminent. It is not joking, it's a practical thing that one observes. But all the cases will not result in eczema.
True.
Thank you, sir.
Disease metamorphosis may end in different aspects. That is where the physician has carefully observing the patient. Thank you very much.
Thank you, sir.
Thank you, sir. Actually, why I asked this question, now I am fully satisfied. Because one lady, she was an asthma patient. She has gone to an expert homeopathic doctor and was taking treatment, and it almost cured. And that doctor told, see, your asthma is getting cured, you may get eczema. That opinion he told. Unfortunately, that doctor expired in a sudden thing. So this lady asked me, I was taking treatment, my asthma is gone, but now eczema has come in my legs. So, of course, as you said, I gave her graphite and it reduced. So, my treatment was correct.
Very good, very good.
But I wanted to know whether any relation is there. That's why I asked.
Yes, very good, very good.
Thank you. So you got a good answer.
Okay, thank you, sir. Thank you. Very enriching. Very good.
Thank you.
Sir, Anup sir, time is over. Shall we
Yes, so
close?
we'll call off then.
Yes, sir.
Thank you very much.
Thank you very
everybody.
much, sir.
We'll call off our meeting today and we'll meet next Sunday.